Is your heart beating too fast? Let's get into it. What's up, everyone? Mike Muellner here. I'm an internal medicine doctor from Los Angeles, California, and today I want to talk about your heart rate and when, if ever, is it beating too fast. So first of all, let's define what a normal resting heart rate is. So most people will have a heart rate when they're just sitting here doing nothing between 60 and 100 beats per minute. In fact, I'll go ahead and check mine. My watch says I got it running right now, 84 beats per minute. So I'm right in that resting range. Now, some people can have a heart rate at rest that's actually slower than that, in the 50s or even 40s. That's more commonly seen in trained athletes, especially those long distance bike riders. In fact, I was reading somewhere that there was somebody, I forgot his name, but he was a professional bicyclist, had a resting heart rate in the 20s. Now, I've never seen that personally. That seems really low, but it's basically just when your heart is so strong, it doesn't have to beat as many times to have the right amount of force to push the blood throughout the body. Anyways, that's resting heart rate. Now, with all of us, when we exert ourselves, when we exercise, the heart rate is going to go up into the hundreds, even mid-hundreds, right? So the heart rate really picks up with exertion, and that's normal. That's what you want. That's your heart picking up the pace to meet the demands of the body and get all that blood and oxygen to your muscles, which are exerting themselves. So that's not what I'm concerned about when I hear about a fast heart rate, especially in the hospital setting. I'm more worried about arrhythmias. So this is when the heart is not beating normally and there's something pathologic going on with the electrical conduction system in the heart, causing it to beat too fast. So a common arrhythmia that I see all the time, pretty much will not go 1 week in the hospital without seeing this heart rhythm, is atrial fibrillation. So normally you get electrical impulses which come from the sinoatrial node here on the top part of the heart, which then travel down to the lower left portion of the heart in a very organized, regular fashion. And then that causes depolarization, heart muscle contracts, and the heart beats very regularly. But with atrial fibrillation, there is a disruption in that electrical conduction. And what happens is the atria, the small part of the heart here at the top, starts fibrillating or vibrating very fast. And some of those electrical impulses get transmitted to the ventricle, the large portion of the heart, which then causes the whole heart to beat too quickly. So here we'll often see heart rates in the 130s or even 140s. And it's also irregular. You don't have that nice regular rhythm that you see with sinus tachycardia, which would be a normal heart rhythm but fast rate. And so this can be a big problem because the heart, when it's beating like that, it's not going to pump blood as efficiently. And a person who is experiencing that atrial fibrillation with rapid ventricular response might feel palpitations like their heart is fluttering. They might even get lightheaded or dizzy or even pass out if the heart is just not pumping blood well enough to perfuse the brain. You can actually faint because of this. And so none of that is good for business. So it's a big priority to not so much get out of the rhythm. There's two ways you can manage that fast heart rate. You can either try to convert the heart back to a normal sinus rhythm, which is sometimes done, or you can just focus on controlling the rate. And that's the more common way to start dealing with atrial fibrillation with rapid ventricular response, is to take medications that, while they still allow the atria to have those fibrillations, that vibrating motion, but they block some of those conduction of the electrical impulses to the ventricles, slowing down the heart rate. So you get a more normal heart rate, even though it's still an irregular rhythm. That will help to mitigate a lot of the symptoms. When the heart rate's controlled, usually people feel fine. The other issue with atrial fibrillation is because that part of the heart is just vibrating like crazy, guess what? Blood pools in that area, and then you can form clots. These clots can then enter the bloodstream and cause a stroke. So with atrial fibrillation, many people end up taking blood thinners to help prevent stroke. Anyway, that was a pretty long-winded example of an abnormal heart rhythm that could be an instance where we don't like to see the heart beating quickly because that's a pathologic rhythm. There are many more of these. You've got supraventricular tachycardia, ventricular tachycardia, ventricular fibrillation, which would be a cardiac arrest. That's not good. But yeah, none of these abnormal heart rhythms are good, and most of them will require a doctor to intervene on the rhythm. So how do we diagnose this stuff? How does a doctor figure out if the heart is actually beating pathologically too fast or with a funny rhythm? Well, first step is you can simply take a pulse. So there's the radial artery right here Back in the day before the iWatches, you could just put 2 fingers on the radial artery and then feel the pulsations. You can time it. I mean, you could sit there and time it for a minute, but most people don't have that kind of time. You could just time it for 30 seconds multiplied by 2. That'll give you your pulse or beats per minute. That's one way to do it. You could also listen to the heartbeats and just count them up. That's another way to figure out beats per minute. And both of these techniques can give you some insight into whether the heart rhythm is regular or irregular and can help you figure out if there's some sort of abnormal rhythm going on. However, what will give you even more information is a 12-lead EKG. So this is where you put the little EKG pads on the chest, and then you can actually measure the electrical impulses in the heart and figure out in much more detail what sort of rhythm the heart has. So in that example we mentioned earlier, atrial fibrillation, what you will see is narrow spikes, narrow complexes. It will likely be a faster rhythm, and you won't see any P waves. P waves are from the sinoatrial node causing the little blips that allow the heart to beat regularly. With atrial fibrillation, because the atria is just vibrating, you don't have those organized P waves. And as a result, the spikes on the EKG will look irregularly irregular. Anyway, back to the main topic of this video. I feel like I just went off on a huge tangent. I'm doing like what Donald Trump calls the weave, going all over the place here. But back to the main question here, when is your heart rate too fast? And so the answer to this really depends on the current state of the body. If the body's undergoing some kind of stress, maybe that's exercise, running a marathon, you expect the heart to be fast. Maybe it's just anxiety. If you feel really panicky, your heart rate's going to pick up. Could be pain. Heart rate increases as a result of pain. Or just sickness. In fact, fast heart rate is one of the Sears criteria. So that's systemic inflammatory response syndrome. You do expect the heart to pick up when you are ill, like if you have the flu or some sort of real bad pneumonia, heart rate will be fast. But if none of those physiologic states exist, and if the heart is still beating fast, then you really have to look at the rhythm. And if you do find an abnormal rhythm like atrial fibrillation, then you have to get a 12-lead EKG to figure out the rhythm. If it's an abnormal rhythm, chances are it's going to require intervention. The doctor will either order medications or, in extreme cases, even use electrical shocks to get out of the abnormal rhythm. Okay, that's all I got for this video. This is a pretty fast look at rapid heart rates. I hope you found this to be interesting in some way. If you like medical content like this, feel free to hit the subscribe button there and check out another video right here, and I'll catch you guys next time.